Last year, Mission Health invested more than $148 million in communities in Western North Carolina. Part of that investment was partnering to develop 4 centers, which will improve access for people across the region to crisis behavioral health services, provide primary care for the underserved, and support for child and adult victims of domestic and sexual abuse.
I think that community investment says a lot in just the title. We're investing back into the community. So our goal is ultimately to understand the needs, to work collaboratively with agencies to really connect the dots and a plan of action, and then to measure the results to make sure that we're moving the needle and doing the right things for our community as well as our region.
Mission has been an incredible partner in the development of this facility. This facility provides a wide range of behavioral health or mental health and substance use services. So we provide everything from routine, outpatient, treatment services all the way up to crisis services. So by having the comprehensive care center with all of the services under one roof, we really want to have continuity across levels of care so people don't get lost in the system.
It's been phenomenal, the work that you've seen with our psych urgent care, RC3 at 356. That truly was EMS, law enforcement, Smoky Mountain as our MCO, our county coming together, just a host of entities and behavioral health providers getting to the table and really talking about a vision and something new that we could do that would give a face for behavioral health, mental health, where do I go for services.
So when we were talking about developing the Mountain Child Advocacy Center, the issue was where's it going to be? And there was a lot of discussion about that, but it really felt like a natural fit to be here at the Mission Children's Hospital right next to the child safety team. So we do service provision where we're directly serving the clients, providing advocacy and support to families navigating the systems. They have to go through multiple systems when abuse occurs. So we're trying to help them, whether it's the legal system, the medical, the mental health, and help them try to figure out what aspects are going to meet their needs the best. So one of the main purposes of the Mountain Child Advocacy Center is to have a kind of a one-stop shop for them, so they can come in and we can kind of evaluate what's going on and try to link them up. Now that we're here at Mission Hospital and we're centered right next to the child safety team, the transition is so much smoother for families. They don't have to go across town. They don't have to do multiple referrals. They don't have to make multiple calls and talk to multiple people. The Mountain Child Advocacy Center would not exist if it were not for Mission and the efforts of people at multiple levels, all the way from the top down.
At the DFL Health Center, we're working hard to make sure that those with the most barriers to accessing care can come here, feel welcome, and get excellent quality primary care. Mission was absolutely critical in getting the DFL Health Center up and running. The public health of a community is tightly tied to how accessible, high-quality primary care is to that community, and that includes people who typically don't get primary care. When people don't get primary care, their needs are met at the emergency department, or they're not met at all. Mission understands that there are different needs for different communities, and we're working collaboratively with Mission to meet the needs of several communities in Western North Carolina.
The Family Justice Center is one safe place where victims of domestic or sexual violence are able to access services from a range of partner organizations. Partners from Mission Health have been at the table planning this project since the beginning. They've shared their expertise and their resources in making this project successful. It truly is a collaboration between Buncombe County, Mission Health, lots of nonprofit organizations, law enforcement, and the District Attorney's Office. Mission's healthcare expertise is an essential piece of the support that we provide survivors here. Knowing that Mission is here providing those services in a way that is survivor-focused helps the rest of the team know that that piece is taken care of. That is what our goal is here, to help survivors feel safe, welcomed, and begin their journey to strength and healing.
We're striving for a healthier community. And you can't be in a silo trying to address one aspect. If you think about it, I could be a person that comes into the hospital with acute needs, and we fix it and we send them back out. But if we send them back out into an environment where they're just going to be right back where they were or worse, then we're never going to get healthier as a community. So we have to take all the social determinants, all the environmental issues into account and really work together as a community so that we can be healthier.